heard of some ways that people think they can tell if a pregnant woman is having a boy or a girl. Like, you might have heard of the chicken test, that if you don't like chicken during your pregnancy, you're having a girl. I didn't like chicken. I had 2 girls. Just saying. Dr. Lewis first looks at some of the myths behind giving birth.
Parents have been telling me they enjoy my myth-busting segments on various aspects of children's health. Well, this week I thought I'd take a step back and provide some answers to the pregnancy myths you have to separate the fact from the fiction when it comes to giving birth. For example, some pregnant mothers tell me that they can tell if they're having a boy or a girl by the shape of their belly, with girls sitting high and boys sitting lower. Well, that's not true. Babies move all the time, and the shape of a mother's belly is really based on baby's movement combined with muscle tone on mother's belly as well as in their uterus. If you want to know your baby's gender, you can ask if you get a prenatal ultrasound what they're seeing below baby's belt. In addition, some pregnant mothers think they should be eating for 2 adults when they're pregnant to ensure their baby's healthy. Well, all you really need to be eating is about an extra 300 calories a day. That's the equivalent of a glass of skim milk and a half a sandwich, and that will about do it. Eating for 2 adults is going to put too much weight on a pregnant mother and put the mother as well as the baby at risk. Now, if you're pregnant during flu season, some pregnant mothers feel you can't get a flu shot because it will harm baby. Well, that's not correct. Mothers' immune systems are slightly off when you're pregnant, so my advice is get that flu shot, but get the killed vaccine, meaning the injectable vaccine that has killed parts of the flu virus that will protect mom and baby and keep them both healthy. And then there are pregnant mothers who are afraid to fly during their pregnancy for fear that radiation at higher heights are going to affect the safety or the health of the baby that soon will be arriving. Well, the truth of the matter is, during the first 2 trimesters, when you're up in an airplane, the amount of radiation is less than you get in a dental x-ray and certainly isn't going to penetrate to the level of your baby. In addition, if you're worried about going through security, well, you don't have to go through that scanner, which also has minimal radiation. You can ask for a pat-down and everything will be fine. During the 3rd trimester, your obstetrician or family physician may recommend that you not fly, but that's not due to radiation. That's just for health reasons. So that hopefully tips like this will deliver what you need to know when it comes to separating the myth from the reality and ensuring you deliver the healthiest baby possible. This is pediatrician Dr. Lewis First from the University of Vermont Children's Hospital, reminding you to always be first with your kids.